Hi, and welcome to Community Hotline. My name is Monica Weitzel, and we're here at MetroEast Community Media in Gresham, Oregon. We've been on hiatus for a little while. We've been converting our studio here to high definition, one of the first places in the country to do that. And if you are watching this on Channel 21, you could switch to 321 and watch it in high def. Otherwise, to stay with us, we're going to have a great show tonight. We're going to start off talking with the City of Gresham. Tonight I have with me Laura Shepard from the City of Gresham. You are now the Communications Director, correct?
I am.
Thanks for being here, Laura.
Oh, thank you for having us on tonight.
We have a really fun show because we're going to be talking about a great event going on in Gresham, and we have a special guest artist who's going to be joining us tonight.
I do.
So the name of the event that you want to talk about, that part of the city's great summer program, is Music-A-Loo.
Right, Music-A-Loo. It's a summer music concert series specifically geared towards kids on the Arts Plaza on various Saturdays throughout the summer.
So has the city ever had a music program specifically for kids?
No. This is actually the second year of the series, but as a program, this is the first time we've actually put together a specific program geared towards kids with music.
So why did you decide to do that? Why not just keep, pitching to the adults? Why are you focusing on the kids this year?
Well, there were a couple of reasons why we started this last year. As you know, we manage the Arts Plaza in downtown Gresham, and in between the other programming from outside groups, we felt that we needed to do some programming on the plaza ourselves, and so I started thinking about, well, what could we plan for the plaza? What would be fun? What would be a draw? And I'm a fairly new mom, so over the last 4 years, I had been going to a lot of different music shows. You always look for things that you can do with your child and
get out of the house.
Yes, exactly. Get out of the house a little bit. Maybe have a cup of coffee, a little adult interaction. And so we started going to these different music shows around the metro area, and I noticed that they were just a tremendous draw. They were a lot of fun, lots of kids, lots of parents, great music, and I started thinking that might be a good fit for Gresham, especially when you think about that 67% of households in Gresham are families.
Oh, that's a pretty high number.
It is. We are a town with a lot of young families, and so I thought, young families, kids music, it just seemed like a great fit. So we put this program together last year. We had a great summer out there on the plaza, and we brought it back again this year.
I think it'll probably be very popular. You have great your posters for it are really cute. I love the design. They're very colorful. I'm sure we'll have one up on the screen. But
thank you.
Yeah, it looks like great fun. So how many different performers do you have? Do you know? How many
We probably have 6 or 7 different performers lined up for this summer. From bands to solo performers, it's a little bit of different type of music for everyone. So,
and will you be taking your daughter?
I have. She's gone. She went to almost all the shows last year, and will be going to several shows this year as well.
As a 4-year-old, she'll probably enjoy them even more.
She does.
So at the plaza, tell me, for those people who may not have been there before, what is the seating arrangement like? What is the venue like?
Well, it's open air. It's a great space, really designed well for music. You bring in your blankets, you can bring in chairs, bring in your picnic lunch, go to the farmer's market, pick something up ahead of time.
It's the same day, Saturdays.
Maybe drop by some of the great shops in downtown, pick up some coffee and some candy maybe, come on down and just really spread out and have a good time with your family. It's been really fun this year. We actually saw one group of folks bring a kid's birthday party down to the plaza.
What a great idea.
For the first show, I saw all these these birthday balloons come floating by. Then I saw a cake go by.
Built-in entertainment.
Exactly.
And it's free.
Exactly. They just carved out a little spot of the plaza of their
That's
own, and they
wonderful.
had their birthday party. And one of the last shows, we saw a lot of family groups meeting up. So the parents got a chance to catch up while all their kids ran around, and they had a lot of fun enjoying the music. So
I bet a lot of people meet each other too. I mean, a lot of people make new connections and new families to get to know. And the kids, you know.
Exactly.
If the kids hit it off, you want to come back again the next week too.
Exactly. I think the kids allow you to open up a conversation. It's hard not to when your kids are running around. And
what is the time of the concert?
The event starts at 11, runs till noon. We tried to pick sort of that sweet spot, you know, not too early but not too late into nap time, and that was just seemed like a really good place to really wear kids out and, you know, send them home with their parents. So
it's not every event you have to consider nap time.
No,
although I wish more people would.
No, not every event we have to consider nap time, but this one I actually spent a good amount of time really thinking about that when we designed this show, just from my own personal experience. Okay, when do they start wearing out? When do they need snack? How can you get out of the house? And
Right. You did a lot of work on this yourself. This was really your baby, wasn't it,
I
Laura?
did. This show really is you know, my baby. So just a lot of those experiences from being a fairly new mom came into the planning, and it's because I had firsthand experience knowing some of those challenges of trying to get out of the house with a kid.
When the kids go out there, is there a place for them to dance?
Oh, there's a big place for them
kids
to
love music.
Yes.
And they spontaneously move to the music.
They do.
Yeah.
I'm always still surprised when I see that. They just go out there and they dance. There's just a big open space for them to dance in, and they use every space. They use every
bit of it.
Yes, they do.
I'm looking forward to seeing some of the footage. I'm going to try to go to a few of the shows, but the ones I can't, I know MetroEast is going to be taping some of the shows, and I hope we get some of those dancing kids in the video.
Yes.
I'm sure we will. We have one of your artists, Mo Phillips, is going to be here tonight doing a little a song for us. So tell me about Mo. When is he going to be on? Do you know when his?
Well, Mo's going to be our next show on July 20th, and he's always a crowd favorite, has lots of fun, kind of as he calls it lo-fi kindy music, but I gotta tell you,
kindy instead of indie.
He gets those kids up and dancing and really active, and so we're glad he's coming back.
It may take a while to kind of calm down for that now. That's the ride home.
Exactly, lull them to sleep in the car.
Well, I think if we've got Mo here, maybe we should take a little break here and listen to some music from Mo Phillips.
Great, let's do that.
Thanks.
Alrighty, this is a little ditty called The Princess and the Cowboy. Oh, there was a little boy, wanted to be a princess, so he put on a pink and sparkly dress, and he wore it all around the town, dancing and twirling, and when he stops, is anybody's guess. Oh no, it doesn't matter what you do, just how you do it. Make sure it's full of happiness and heart. Oh no, it doesn't matter what you do, just how you do it. Make sure it's full of love right from the start. Doop doop dibby dibby dip dip dibby 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 dip doop. And there was a little girl, wanted to be a cowboy, so she put on some chaps and she put on some cowboy boots, and in a 10-gallon hat, saddled up a palomino, and with some outlaws, she fell into cahoots. Oh no, it doesn't matter what you do, just how you do it. Make sure it's full of happiness and heart. Oh no, it doesn't matter what you do, just how you do it. Make sure it's full of love right from the start. And all the world is a place for you to shine. And all the world is a place for you to shine. And all the world is a place for you to shine. And all the world is a place for you to shine. Shine. 'Cause it doesn't matter what you do, just how you do
That was awesome. Well,
It's hard not to be in a good mood after listening to that music.
that was really, really fun.
It
I
is.
love that. I
It
love
is.
that. So we can look for Mo on the next show, and if all the music is that fun, we're in great shape.
It is.
So after Mo plays, then we have several other groups. You said you have bands and you have other groups coming on.
Yep, we do.
We have a lot to look forward to. We have there's a group that's going to be playing, or a duo, I guess, Jason and Johnny, and we have a little bit of video from one of their performances, and they're going to be near the end of the.
They are. They actually opened the series, and then they're going to come back on September 21st with Mo, and we're going to do a special end of the summer concert.
Oh, fun.
To wrap
That'll be
up the
good to
series
have.
and to wrap up summer.
You do kind of a whole 93 days of summer. Is that what it is?
We do. We have a social media campaign that's also in its second year.
With the city.
With the city. And on our Facebook page, we post something fun and interesting and usually free to do in Gresham every day of the summer. So all 93 days, you'll find something to do on our Facebook page.
I bet a lot of it is family oriented.
It
that
is.
right? Yeah.
It is. There's a lot of the activity in Gresham, and it's good to showcase it and expose people to Gresham.
Cool. That sounds like so much fun. I'll be checking this Facebook page
Great.
regularly then. And in the meantime, let's take a little look at Johnny and Jason and see what they've got going on. And
Great.
then if everybody would just stay tuned to us, don't go away because we'll have Mo Phillips back on the set with us and we can talk to him a little bit.
Big Jim had a bad reputation all up and down Tarnation. People said that he was so mean. He chewed on nails and drank gasoline. Woo! Well, there I was by the water fountain. When up walked Jim, just as big as a mountain. Oh man, I was petrified. But he looked at me and said with a smile, I like syrup on my pancakes and kisses on my cheek. Smell the rain in the summertime and swimming in the creek. People give funny ideas because I look so tough. You and I will be good friends if we hang out long enough. Well, Gertrude Carey was the scariest teacher in town. She canceled recess for a year. That was one story that went around. My mama told me, Johnny, honey, I'm having an old friend over 14. The doorbell rang and I opened it up. And I found Scary Carrie right in front of me. Oh, no. But she said, I like syrup on pancakes and kisses on my cheek. Smell of rain in the summertime and swimming in the creek. People give funny ideas because I look so tough. You and I will be good friends if we hang out long enough. I like syrup on pancakes and kisses on my cheek. Smell the rain in the summertime and swimming in the creek. People give funny ideas because I look so tough. You and I will be good friends if we hang out long enough. That's right. You and I will be good friends if we hang out long enough.
Mo, that was fantastic.
Thank you.
That was so much fun. I really enjoyed that. Now, if I liked it that much, I imagine the kids are going to think it's great, but it's really not just for kids, is it?
No, I mean, it's definitely for everyone. And there's actually a bit of a debate in the kids' music world right now that if you promote your CD as finally something for the whole family, like, it's a joke because everyone is doing something for the whole family.
Yeah.
Like it's no longer cachet. Like nobody owns it in terms of something for everyone,
Right.
because everyone is writing this amazing stuff. The scene has blossomed and has grown into such fantastic heights that like everything coming out now is for everyone. So it's
That's great. That's great.
It's awesome.
The music, that particular song has some undertones, some little subtle messages in there. I mean, it's kind of like the gender stereotyping thing is sort of thrown out the window, which I really think is cool.
Yeah.
I really like that.
My son had asked me to write him a princess song.
Really, I love it. I
So
love it.
That's what, and we did, and I wrote that, and then I played it for him, and he was like, "Dad, that's great. There just wasn't enough twirling in it." So,
Hey, there you go. Well,
we wrote a song called "Twirling" right after that. It has a
so
lot
great.
of twirling.
So how old is your kid? You have the one kid?
No, I have two. Owen is 6. He's the twirling ninja princess, and Henry is 9.
Great. So a little bit of inspiration there.
Oh, more than a
Totally.
little. I mean, they're both are massively influential. Whether it's just stuff that they do or helping me write. I mean, they've
Really?
both contributed a lot to the writing.
How
as
great
well.
is that?
They're
That's-
awesome.
Yeah, it's kind
They're
of a family business there too. Then.
That's right.
So what's the music scene like here in Portland for this kind of music, for family?
It's
music?
unbelievable. It's fantastic. I mean, there's heaps of acts out there, and Musicaloo has got a great slate.
Good lineup, huh?
But has
Yeah.
not even there's tons.
So they've only scratched the surface.
Just
huh?
scratching
Yeah.
it. I mean, we are really blessed in this community, and to even a greater extent the Northwest, because Seattle has a ridiculous scene as well. In between, in the Cascadia region, we've just got an awesome amount of kids music and family music.
That's right. That's
It's really
right.
cool, and
Yeah.
it's growing. And in the last 5 years, it's completely exploded, but it hasn't suffered. Like, it hasn't grown so big that there's this talent, saying it's like it's just
Right.
everything is getting better and better and pushing each other. So it's great.
So do you strictly do this kind of music? Are there, like you said, it's kind of for everybody, and
Yeah.
everybody does everything.
Well,
for
no,
everybody.
I mean, that's true though. In that regard, I can't go to Dante's downtown Portland and play this stuff. So,
Yeah, it's probably not a big draw,
it
but-
is. I do have some venue restrictions, but
So what do you have coming up this summer after Musicaloo?
tons of library stuff. So the libraries is bread and butter for a lot of working musicians in this genre. I'm in every Washington County library this summer. I've already played heaps of them.
Really?
But I have more to come throughout July. I'm doing Cooch Park in Portland on Thursday, August 8th, a part of the Portland Park and Rec's summer concert series, which is also fun. Like the way Musicaloo is an outdoor show.
Yeah,
the same-
the outdoor shows have got to be fun.
best.
I would think that would be the most fun, especially
They're
if
so
the weather
fun.
cooperates.
Yeah,
Yeah.
and they're so fun for families too, especially those ones where you can lay out. And in the evening shows, you bring a picnic, you have a glass of wine, you have a beer. The kids are dancing like mad, and
You
it's
go
great.
home, you're tired, they're tired, everybody
they
goes to bed
pass
and
out.
sleeps well.
Oh, it's awesome.
Yeah, that sounds good. What about, Laura, rain or shine? What if it rains?
Well, it is a rain or shine situation.
It is, okay.
So yeah,
If it rains, you bring your
we're-
umbrella?
Exactly. We're not afraid
And
of.
twirl with your umbrella.
That's right.
We have the musicians under a tent, and we're not afraid of a few sprinkles. But that's
If
not
you're an
that's,
Oregonian.
that's not going to happen this
Yeah.
summer.
You
It's
know,
going
I
to be
don't think
blue
so.
skies
It's been pretty good so
all
far,
summer.
so
It has.
I have good hopes for wonderful weather this summer. So you are performing other places throughout the year. How far ahead do you book out for this kind of stuff?
It depends. I mean, this summer, Washington County booked me this summer last November.
Oh wow!
So it's much different than when I was playing strictly rock and roll clubs and we were booking, maybe a month out. But it's been great. I mean,
There's a little
actually,
more security doing it this
there's
way. isn't
way
there?
more. I mean, it's an amazing. I'm now a working musician in this
Yeah.
genre. I went from starving artist, who also I taught preschool for years and years.
really?
But I would go and play rock and roll at night, and then once I mashed those two things together, then I became a working musician because of libraries and because of schools. I work with young audiences of Southwest Washington, Oregon, and they put me in schools to either teach residencies or do performances.
Did you perform for your preschools when you worked at the preschool?
Oh yeah. That was a.
was
I mean,
part of it,
a
rather,
lot
part
of
of the
what I
curriculum.
do was built from that curriculum.
Yeah.
We would write songs together all the time, and now any library show I do, we write one song together, and then I record it and we put it on the website.
So tell me, what's the process of working with kids to record a song? I remember
Well-
when my kids were in school, Michael Allen Harrison used to come to their school,
Oh,
and
cool.
they'd work on creating some songs. And
Yeah,
that was
yeah,
really
yeah.
special, you know.
Yeah,
and the
yeah.
kids loved it, and they learned a lot from it. So
Yeah.
what do you do? How does that process work?
My process is pretty ridiculous. We start with one of three things: mood, melody, or subject. And then we go from there. We choose one, say we choose mood, and then so we decided to write a grumpy song. And then we're like, okay, well, what are we grumpy about? And then we get some subject going, some subject matter. And so we and if anyone's willing, and this is almost always for me the most rewarding, is if someone actually develops a melody, their own melody. It's like, this is great, you know.
Yeah.
So that's essentially how I do it, and try and go through a couple moods and then wrap it up with some, you know, like happy goodness at the end. You always want to end on a high note.
Yeah,
right?
yeah, that makes
So
sense.
it gives
that
me
makes
somewhere
sense.
to go.
You don't need to send the kids home grumpy.
Not at all. But yeah. And,
What about recording? Do you do any recording?
personally or with
Personally
the kids?
and with
Oh yeah, yeah.
and
So
with
I
the
have
kids.
I have 3 albums out. The first 2 were done in the basement, and are progressively, you know, get better and better. The third one,
That's
Monster
the hope
Suit.
anyway,
Yeah,
huh?
yeah. Monster Suit was done.
Monster Soup?
Monster Suit.
Monster Suit.
Monster
Okay, I like
Suit
that.
was done in Johnny Keener of Johnny and Jason in his studio Sidecar, which is a lovely place, and he had a big hand in that album. And we're headed back to the studio in September for the 4th album. So it's very exciting. I love recording. It's
Do
good
you?
times. Oh yeah,
Yeah.
It's a lot of fun. It's
I mean, it lives
really
on, you
sloppy
know?
and messy and awesome.
That sounds like fun.
Yeah.
So, Laura, you looking forward to seeing Mo perform?
Oh,
Music Balloon?
definitely. He's always a really fun artist to watch, and it's just so fun seeing the kids respond to him and respond to the other artists that come out, and it's just amazing how much it's grown.
Yeah,
It's,
it is to me. I don't have small kids now. I'm waiting for the grandkids to come. It will really be a huge, out of control music scene by the time I have them. But there's a lot of things to do in this area. Are you from this area? Do you live in the Portland
I
area?
live in Portland, and I've
Yeah.
been here since '94, so I definitely consider myself from around
Yeah,
here now.
yeah. So outdoor summertime here is so amazing and wonderful.
Crazy.
You know, people
Yeah.
come. I have friends that have been visiting from Arizona, and they're like, "Hey, it was 125 last week," and we're like, "Hey, it's great here."
Yeah.
So, what other things are going on in the Gresham area this
Oh,
summer?
there are a lot of things going on. Of course, our program, Musicaloo. I know the Center for the Arts Foundation has brought back their Music Mondays music series on Monday nights at
Right,
6
and
p.m.
We'll be doing some taping of that.
And actually, a few of the acts that are playing Musicaloo will be playing Music Monday. I know the Alphabeticians will be there. I believe the Toy Trains will be there. In addition to what's going on the plaza, I understand that I know the Jazz Festival, it will be coming back on August 3rd
in
again.
a sort of a smaller form than the old. one
Yeah,
that used to
yeah,
be at Mount Hood Community
right. It was
College.
very large at Mount
Yeah,
Hood, but
yeah.
I think it's just perfectly sized for the plaza.
People love jazz out here, yeah.
They do. And then just, throughout the summer, there's always these great little events. There's the Cruise In on Wednesday nights.
right,
and,
right.
and there's just a
With all
lot
the
of
old
really
cars and
great
stuff.
events that people like to go to, and actually come from around the region to go to a lot of these events. And Musicaloo actually is one of those draws. I mean, these groups have great followings, and we're just so excited to not only appeal to Gresham residents, but have people who are coming from Portland and Beaverton and Vancouver who come and see our great arts
Right.
plaza and get to see our nice downtown and get exposed to Gresham maybe
Yeah.
in a way that they just haven't been before.
A lot of
So,
people don't know that this is really a pretty cool little
yeah,
area.
it is.
Is that true for you? Do you have groupies, Mo? Do you have kid groupies that follow you around?
Well, I have a really awesome fan base, but that has one of the better kept secrets about this genre is that we have this crazy turnover. If you're in a rock and roll band from the '60s, then a lot of unless you're amazing, ridiculous,
Yeah.
your crowd follows you in age. Okay.
Yeah.
Right. And so as you become 50, so does your
So,
crowd.
yes, yes.
Okay.
Yeah, the 20-year-olds aren't,
There's
climate
the
just-
babies just keep getting born for me. They just keep making
It's
babies.
for you. The
It's-
babies are
that's right.
born for you.
Right. Yes, that's right. Bring the babies. Bring me babies.
Bring me your children.
Although I will admit, I will give my daughter up. She's actually a groupie. She follows a few bands around.
I love it. They have the T-shirts,
Yeah, we got T-shirts, tiny T-shirts,
Yeah.
onesies.
But that's what's
And
so.
tutus is when you need tutus
Oh,
for the
yes.
twirling and the
Oh,
princesses.
yes.
Little
Great
pink
idea.
tutus.
Tutus.
Yeah.
But I think that's what's great about this music is at a young age, kids are loving music. They have favorite bands. They have
Yeah.
favorite songs.
It's just like mom and dad, only on just a little
yeah,
different level.
and they're getting exposed to this great music at
Yeah.
an early age, which just helps with so many other developmental stages. So it's really, I think it's great. So.
Yeah, there's definitely. I had a fan at a show last week who was requesting a song, just going la 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 la, and mom was like, he wants that toe song where you go la 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 la.
Really?
That's why he calls it the la la. So yeah, they totally
So this
grab
kid
right
could
onto
hardly
it.
talk,
He
but
can't
was
talk, but he
was
wants
requesting
la, la.
the song.
Yeah. That's awesome.
So,
They'll be out there with little
so
baby dicks.
when you're performing, do you ever have kids bugging you like?
Oh, yeah.
causing problems?
Last night I was in Tualatin, and Tualatin has a really cool commons area as well, outside of their library. And this kid was standing in front of me, and we had just finished a song, and we were talking about donuts. And this kid was maybe 2.5, I don't know, maybe 3, and he just stood there yelling at me, "Donuts, donuts, donuts!" for like the 3 songs closing the show.
Oh my gosh!
Donuts, donuts.
Well, obviously, you need to bring donuts with you next time. You throw them at the kids.
And
shove 'em up.
I'm a major proponent of donuts. Like,
Have them too. Next
you know,
time, bring donuts.
yeah. So I wasn't, and I was fine. Like, you bring it, dude. Donuts. That's it. But
So you've
yeah,
been heckled by
Oh.
a 3-year-old.
all the time. Last night was brutal, but it was good.
That's great. That's great. What's your favorite part of performing for kids?
It's kind of twofold. One is that they're thoroughly forgiving. So they don't,
If you mess up a few
there's
lyrics
no,
or you
no,
know,
there's no
hit the
judgment.
wrong note,
There's
you're
no
good.
judgment. And secondly, reckless abandon. It's like there's, this town is, well, this region, and certainly Portland proper, is known for its shoegazing and for its standing around and, being too cool for school. And the kids are not bothered.
They're not, yeah.
They are just out there to rock, and it's liberating.
That's
it's
great.
awesome. I love it.
Yeah, it's liberating. It would be, yeah.
Yeah.
They just they what they feel and they express it, and
They just
it's
want to
all
party.
good.
Yeah,
I love it.
And they want their parents up and doing it with them.
that's true.
Which
So
is
do
a
you
lot
get
of
up there and dance with the kids?
I've been known to dance on the plaza.
Shake a leg on the
Yes, with the
plaza?
kids, do a
Yeah.
little twirling,
Yeah.
do a little throwing up in the
I
air.
want to bring my camera to this. Next one, I'll be
It's
fun.
a good time, and
Yeah.
we have people without kids who come and watch.
Oh, I'm sure
the
you
music.
do.
The music's
If the
so
music is
fun,
like that,
and
I
it's
mean,
just-
I'll be there. That's
it's
good fun.
It's a good time.
Yeah,
it's a good time.
it's not like, like you think about like Barney or something like
Yes.
that. They kind of like, after a while, you just want to throttle them because it just gets annoying, But that's good music. That's fun
It's
stuff.
changed a lot. I
Yeah.
mean, and that misconception is strong. So, it was 10, 15, 20 years ago that it was still pretty saccharine. I mean, there's been amazing stuff happening for the last 30 years,
Yeah.
but it's just been really underground and hard to find. But now it's
mainstream now.
busting out. And it's just gotten so almost cerebral. I mean, you look at like the movie industry, like Pixar and stuff. These kinds of movies that have so much are rife with innuendo, and these things to kind of appeal across all spectrums. And the same thing's happening musically. So it's
You think
it's
about
great.
like cartoons, how cartoons are more of, if you watch them, especially older cartoons,
Yeah.
they're geared toward adults. I mean, they have all sorts of humor in them that just
Yeah.
totally goes over the kids' heads. And
Yeah.
this music has a lot of stuff for everybody. It's like that.
Yeah,
I mean,
yeah.
it's like, this is for the kids, but
Absolutely.
really the adults are going to get just as much
Oh, it's the
out of
same
it.
thing. As a parent or as an adult watching the shows, you'll sit there and you'll be chuckling at some
Yeah,
of
I
the,
was just
some
grinning. I was
some
just
of the funny
grinning
inside
watching it. I
jokes
was
in
like,
some
yeah.
of the songs.
Yeah.
And
Yeah.
the kids still love it. It's
Yeah,
great.
that's great.
Yeah, fitting that in is really also a part of one of my major goals in terms of when I'm writing, is something to pique the parents' interests. I have a song about a penguin that, goes to Florida to maybe find a long-legged flamingo. And, that kind of stuff doesn't, it's just like for kids, it's, a penguin and a flamingo, that sounds great,
Yeah.
a couple birds. But there's a little bit more to it
Yeah,
for the parents,
yeah.
and just random stuff like that,
I
whatever.
think it would be challenging to be able to
Yeah.
find that mix where it appeals to both. But
Yeah.
you seem to be doing it very well.
It's the challenge, but it's certainly a goal to strive for,
That's great. Well, we're just about out of time, and I think we've got the Johnny and Jason video,
Great.
which we can take a look at. Which we saw
Yep.
before, but now we've also got some video of the 93 Days of Summer, or the stuff that's going on in Gresham. And
Great.
you gave us a little flavor of that. So let's take a look at that. And,
Wonderful.
I enjoyed having both of you on tonight.
Thank you so much.
I'm looking
Thank
forward to seeing
you.
you later. I know I'll be
Absolutely.
seeing you, Laura, and thanks so much for being here.
Thank
on
you.
Community Hotline.
Thank
Don't
you.
go away. We're going to see a little video about Gresham, and then we'll be back with house call providers, and you don't want to miss that.
We love Gresham and we love fun. So we're putting the two together for the 93 days of summer. Experience our trails, parks, and places to ride bikes. Every day starting June 21st, we'll be posting all of the fun and exciting things to do in Gresham to our Facebook page. Delight in our farmers market. Enjoy our outdoor music and community events. Go ahead and grab your sunscreen and get ready to spend the 93 days of summer in Gresham. Follow us on Facebook for our daily summer fun forecast.
Community media is priceless.
Valuable.
Community media lets you tell your story to fit your needs.
My favorite thing about community media is it's got to be the people's shows.
I think my favorite one is Karaoke Oli.
Oh, Karaoke Oli's a good one.
We sing live karaoke on TV for an hour.
Hamster versus Monster.
Nap Time with Kittens.
Community media brings programming like Chambers of Commerce, the Faith Community.
Psycho Chicken.
Do you have any UFO shows?
No, I wish we did.
I would like one of those too.
Yeah.
Children's programs, high school sporting events, and of course, the ubiquitous city council meetings.
Only when we hear from folks in their own voices with their own stories can we truly connect.
KZME Radio is a new station that is committed to entertain, inspire, and connect our community through programming that celebrates local music, arts, and culture. It was created to put local music and local arts on local radio, and it is a vehicle for our creative community to gain exposure while also celebrating what the Portland metro area has to offer.
Hello, my name is Bombshell Bailey, and I am the host for The Spunderground. It's 2 hours of EDM, electronic dance music, every Friday night from 8 to 10 o'clock on 107.1 KZME. I love this radio station because it gives me the opportunity to play electronic dance music, which you don't hear anywhere in town, at least not on corporate radio. There's a huge EDM scene here in Portland, and The Spunderground on KZME gives me the opportunity to highlight all the phenomenal artists that are here in Portland. We ask you to support KZME because KZME is supporting you. We are playing local artists, local musicians, and we need to be supported by the local community. KZME is community, it's not corporate.
For more information on how to support and get involved with 1071 FM KZME Radio, see our website, www.1071fm.org. KZME Radio, music where you live.
Wow, these are really good.
You act surprised. Practice makes perfect.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who don't need perfection. They need you.
Hi, and welcome back to Community Hotline. I'm Monica Weitzel, and we're here in Gresham at MetroEast Community Media. I'm glad you stayed with us because now we're going to talk with a group called House Call Providers. It's a group that's new to me, and so along with you, I'm going to learn all about them. Here representing House Call Providers, if I can get the words out. Barb Gorman, you are the communications specialist, and Todd Lawrence, the volunteer coordinator.
That's correct.
Thanks for being here today.
Thank you.
We're thrilled.
Good, I'm glad. House Call Providers has been around for a while, correct?
Yes.
So tell me a little bit about the history and why it got started.
Okay.
Yeah.
House Call Providers was started about 17 years ago by our founder, Dr. Benneth Husted. And she really saw a need in the community for treating the patient in the home. And what we're talking about here are people who are very sick, have 2 chronic conditions. So she started out with about a couple of patients, which quickly grew to 100 patients, which more phone calls were coming in because the need in the Tri-County area is very large for this type of primary care in the home.
So when you say primary care, the doctors working in for
doctors,
House Call
nurse
Providers,
practitioners, and physician assistants.
they would be the primary care provider.
Yes.
They're not in addition to somebody else's primary care provider.
No, when you come on to House Call Providers, you are switching over to our care exclusively.
And house calls, I mean, who does house calls? I mean, it's something that kind of went out the door a long time ago. You know, it's not Marcus Welby anymore. You know.
Yeah.
Well, that's the idea.
To remember.
Right. The thought for years and years and years was that you couldn't do house calls because it's too expensive, or it's you know, it was this old idea from like you'd see it on Little House on the Prairie. The doc would come to the house or whatever. That's sort of how we saw it. But really, for most of history, that was the way medicine was delivered. And the reason people started going to the doctor's office was that we developed these really large machines that you had to go visit.
Right, right.
Now we live in the era of these small machines.
So things are kind of coming
right.
full circle here.
We have the ability, the portability to do it, and it really makes sense to do it. And we're sort of, people just have been doing it this way because that's what our generation or the last few generations have sort of always known.
Wow.
But it turns out it's feasible.
Yes.
And you've been doing it for 17 years, though.
Yes.
That's quite a long
So
time.
the growth has been constant, and in the last 4 years, our budget has quadrupled.
Wow. But this is a nonprofit.
This is a nonprofit.
So how does that work?
Well, it works. First, I want to tell you a little bit about what our patient.
Okay.
So this is someone who is, as I mentioned, about 83 years old. We've all seen the person in the doctor's office who has taken the medical transportation, who is asleep in the chair. One thing that when I talk to groups that I really want to get across is that House Call Providers is bringing back honor to our elders. We are treating them. We are able to get on top of conditions that they might have by being really aware of the tests they've had or their past history. We aren't getting the 15-minute knock on the door. They aren't getting the 15-minute knock on the door. We are spending over an hour with the patient once a month up to once every 6 weeks.
In their home.
In their home.
So it's more of a holistic approach. Would you call it that? I mean, as far as your
I would definitely say that, because one of the benefits of going in the home is looking around, seeing the environment, being with their caregivers. We do all that.
Okay, let's talk about that a little bit in more depth. But first, you have a video you brought.
Okay.
I think we should take a look at that now. And after we watch that, I want to get back to that because I have some more
Great.
questions about that. So let's take a look at that video now.
Okay.
They came to my home at one of the most difficult times in my life, one of the most difficult times in my husband's life. We lived in a home that required you to walk up a full flight of stairs to get to the car. He was incredibly weak from months of chemo and radiation treatments and couldn't do it. They kept him home. They made his passing, his journey, as easy as it could be. And were incredibly gentle with my heart at the same time.
All of our patients are homebound. That's the first hurdle they have to go over when they call for services. How are you having difficulty getting to your doctor's office? They virtually all have multiple chronic conditions. The median age is 83. That's the median, so half of them are over 83.
I feel it's so special and so much of an honor to help families and the patient themselves be there at the end of their life. So I think that's one of the things that I think is just really great about this job.
There are thousands of individuals out there that are homebound. They don't get the care that they need, and it does cost our community.
Elder care, it's really about function, and you can't really assess an elder's function unless you see them in their own environment. And you can see them a lot more often than their family will be able to get them out to a doctor's office.
That, I think, was his biggest concern, that he was going to have to be somewhere away from his home. They made it possible for him to stay there. They checked on him every day. His pain was controlled so that he was comfortable.
I was raised by my grandparents, so they were like parents to me. So when I see an older patient now, it feels like I'm taking care of my grandparents.
To be able to see an individual at 90 and how much of a rich life that they've lived, and then to be able to care for them at the end of their life is just really, I think, it's an honor.
My first patient came to me as a referral from a friend of a friend who had some dementia, but was still with it enough to walk and talk and be very cranky, had refused to leave her house for 10 years.
These are your mothers, your fathers, your grandmothers, your grandfathers. These are people that we need to take care of.
After just 3 months, I had over 100 patients, and only then began to realize the magnitude of the need.
He would joke and laugh with Rebecca when she came. They developed this incredible bond, and she was probably the only other person he saw besides me, and it was the gift that she brought to him in her kind and caring and listening to him and learning about him and how it was amazing.
From the beginning, part of our mission was not to refuse services to anyone for inability to pay, and we still honor that. As a result, almost half our patients are below the poverty level.
From the time we added our hospice 3 years ago, we have risen from about 30 staff to almost 80 just over the past 4 years.
The population is aging. More people are living to be old, and many of those people have multiple chronic conditions. I think that the office-based system of delivery of primary care is not really viable for a patient population that is having such great difficulty going to a doctor's office.
Not everybody can get out and go to a doctor. Elderly people like my husband who were too weak to get up and go. I will never be able to repay them for what they did for Billy and for me, and if any little thing I could do that would be helpful for them, I am happy to do.
moving. That was really moving. You can tell that the people can really care, don't they?
Yes.
Very much.
It's a very personal service that you're providing. You know, obviously our population is aging. You know, the baby boomers are all getting older, and I can see where there would be a huge need for this. And I know, having had elderly parents, and I just lost my mother a couple months ago, and how difficult it was getting her to her appointments. You know, I was the one who took her to her appointments. That meant time off, you know, of work for me, and I didn't mind doing it. I, you know, love to do it for Mom, but it meant time off from work, arranging for medical transport because I was not able to transport her in my car. You know, getting to the doctor's office. You know, sometimes you're there and they need to go to the bathroom, so it's hard to get them to the public restrooms. It's just all those little things.
It's the ripple effect of house call providers. We're not only helping the patient, we're helping the family too, to know that your loved one is getting this kind of care.
Right. Yeah. You know, I think as a society we're grappling with this idea of how families have spread out. Just this morning, my sister had come into town for a visit. It's the first time I've seen her in a few years. I just dropped off at the airport. She got on an airplane to meet my parents in another state. And I think a lot of us have had experiences like that where families aren't close anymore. And then even when they are, like you had, then just what it takes for one person to be that caregiver, that person. So many of us have had that experience of managing a long period of time. And with the people we have who are homebound and disabled, often many, many years before the end of life.
Right.
They're stretched to the
limit, because being a care provider is a very difficult job. I know I was fortunate. I had two sisters who lived here, and my mother actually lived in a really wonderful place where they took great care of her. But you know, my sisters and I were very involved in. But a friend of mine just visited from Arizona, and he has two elderly parents who are pretty much homebound, and he is their only child, and he's like, you know, that's his whole life now, pretty much, is taking care of them, and that's really, really difficult. It's hard to, you know, find a life outside of that. So that gives them a real respite from that.
Well, I was going to say the other side of that is that people often skip their appointments to the doctors when it's hard to get to them.
Yeah, sure.
And then so they don't end up until they get into seeing a doctor till they get to the emergency room. And so that's
so the emergency room becomes their primary care.
Right, which is that's not an ideal situation.
Absolutely. And when you think that there are 3 to 4 million homebound Americans across the United States, right now we're involved in something that's really exciting. We're just finished year 1 of a national demonstration project called Independence at Home. And Independence at Home, we're one of the sites, along with 15 other sites and 3 consortia, that is testing out a Medicare payment model that would reward sites or practices that are saving money by delivering this type of care.
Really?
Yes. And we're really excited about what that could mean for this population, because the reason that people aren't doing it is they can't, the reimbursements are too low. So if Medicare, which as we all know needs a little help, can save money, and this type of care, they call it the triple aim: better care, better health at a lower cost. House Call Providers House Call Providers has saved millions and millions of dollars by giving better care. It makes sense. Senator Ron Wyden, as you saw in the video, he was one of the sponsors of the bill. This is attached to the Affordable Care Act, and we're just really excited to see what will come.
That's great news. So I hope it all works out, because that sounds like a great plan. You know, I like the idea of the House Call Providers going to the house and being aware of the surroundings of the patient, because I mean, tell me about that. You've probably have you made those calls yourself? Have you been to patients' homes?
I will defer to my colleagues.
So what kinds of things have you seen that have, you know, that you've been aware of, that you've been able to point out or take care of for somebody?
Well, I mean, that's a huge question and a huge subject. I mean, we see all sorts of things, and it's interesting because a lot of times when I first encounter these people, they're a sheet of paper.
Sure.
You know,
they start out as a number or just a name.
And I get, you know, a little bit about the case, and invariably, you know, when I go to meet them, their whole world, you know, like, I mean, I don't see every part of the world, but they become so much more than that paper.
Of course, yeah.
Yeah, and I think that a lot of times when doctors see us in sort of the impersonal, we go to their place, we walk in and we're just a person who walks in.
You're there
There's
15
no
minutes,
context.
Yeah.
What I, you know.
You see where they live and if they have pets and what the state of their home is and if they're dirt poor or if they're actually in pretty good shape, all those kinds of things.
Yeah, you see
how they eat,
the
perhaps,
pictures
and
on their
that kind of thing.
wall tell you so much. Who loves them? Who they love? What their life is about? And I mean, as volunteer coordinator, my job in a lot of cases is bringing people to them and trying to bring some. You know, if you bring everything to someone who's homebound, it's great to do that because they really can't get out for themselves a lot of times, but you also run the risk of isolating them. So one of the other things you have to bring is you have to bring some community to them.
So tell me about the volunteers. Yeah. What exactly do the volunteers do at House Call Providers?
There's a lot of things. So one of the things they do is companion visits.
Oh,
and
right.
so basically going in and spending an hour of time with someone in your neighborhood. And one of the reasons we're here today is to try and get the word out beyond the 3 square miles where we're sort of known to the entire area, so that people in Gresham or Hillsborough or, you know, like all over
Gladstone,
right, all of those places know that there's somebody in their neighborhood, somebody who lives maybe a mile from their house that they could go and visit and spend. It's an easy volunteer assignment in a way. You're just going to talk, but it means a lot because, you know, when somebody's, especially for the people on hospice, but really anyone who's in this situation, when you're having that question, what does my life mean? You're at the end of your life, what did it all add up to? And you're going through that sort of existential, those questions. To have that person show up at your house is the most eloquent answer to that question without them saying anything. You matter enough that I came.
Oh, that's really touching, actually. Yeah. And I imagine that what the volunteers get out of it is huge.
Oh yeah.
I mean, speak for yourself. How you know, have you had some experience where you just...
Sure. So I'll talk about my the person that I first volunteered with was a woman named Lisa, and she was she'd been a writer and she wanted to tell her story, and I came with a tape recorder and just listened to her story, and she spoke in the most beautiful prose. They don't all.
Right.
You know,
sure.
But she did.
She spoke like a writer.
She spoke like a writer, and it was this, like for me, it was like this entry into this world, like that she when she was a child, this world that existed 40 years before I was born.
Wow. It's like having an audiobook right there, but in person. You know.
And so I got to listen to her, and it was amazing. And then afterwards, I had a volunteer who transcribed for me, and he would come in like to my office with like pages and say, "Look what she said here. Look, you know." I mean, like
he got something out of it too.
Even just reading. I mean, it was like it's amazing the stories, what you hear from these people. What you know, it's a world that's gone that they.
And everybody has a story, don't they? I mean, everybody has a story.
So you asked what volunteers do. One thing they do is those visits. Another thing is respite visits. It's a little longer, but actually allowing the family to get out. Yeah. You can imagine when you were in the situation you were in, like how hard it is to.
Yeah, sometimes you just need a break, and it gives you, it refreshes you to have that break, so that when you come back to them, you're not worn out and resentful. Because I think it's easy to get resentful. No matter how much you love somebody, you can get resentful that I'm losing my life, but having somebody give you a break,
3 hours can
be
an eternity.
Sure it is.
Well, and that's again when I was saying that we haven't, as a society, you know, the fact that people towards, you know, when we hit this portion of our lives, that if our parents are alive, that we spend this much of our time worrying about them. You know, we're all going through that. Every one of us goes through a version of that, and we need better answers, and House Call Providers is not the answer, but it's a part of the answer, and you know, I'm proud that we're part of the Portland community, and that Portland is sort of part of what might turn out to be sort of a national answer.
Yeah. Are there other organizations like this around the country? Is it typical?
We are, in the demonstration, we are the only standalone nonprofit.
Really?
I do believe that this is becoming a little bit more common, but right now, I'm not really sure. Right now, I believe that we are the only house call nonprofit in the state of Oregon.
Right. We didn't invent the idea of home care. There are other great home care organizations in the area, and they do great work, and we should
But not
that
as yes, they do. They do. And
Right. But what we're doing in terms of this national model and in terms of helping to quantify sort of the savings for Medicare, if you know anything about the history of hospice, you know that there had to be a demonstration program where they had to find out whether hospice worked. And now we're sort of in the same thing to find out whether this works. And it potentially could be something that becomes a national thing, at least we hope.
Absolutely. And just to put, also just to let your viewers know that we are looking for doctors and nurse practitioners to join us and to join our mission. And I invite them to go to our website where they can ride along with one of our nurse practitioners, Amy Long. She was in the video, and kind of see what her day looks like, because this isn't for everyone.
Right.
This is a vocation, I've often called it.
Yeah, I can see that.
And also being a nonprofit and being part of the development and a fundraiser, I actually have to say that donations are welcome.
I'm sure donations are always welcome.
And the community has been wonderful to us, especially in supporting our Independence at Home participation.
Good. Todd, you mentioned volunteers and that you needed volunteers. You always need volunteers.
Yeah.
You're going to be doing some trainings soon, I understand.
Yeah, in August we're going to be holding a training at our office, which is in the Johns Landing area, and it's going to be on Tuesdays and Thursdays. I think starting on the 12th. This one is during the daytime. I sometimes do them during the daytime and sometimes in the evenings, but the training's a really great place to sort of like have a conversation with other people who are interested and with yourself about just a subject of what do I have to offer another human being? What can I do?
Right. A great opportunity for people to have a little time on their hands and want to make that time more meaningful.
Absolutely, and as we said earlier, we really want to reach out to the outlining areas to get those community members involved.
That's great. And we're just about out of time, but you mentioned you have hospice also. So people are part of the house, the program, they can kind of transition into hospice.
Absolutely. Right now we have about 1,400 patients, and our hospice only takes our own patients.
Okay.
And it's a really beautiful transition. Their clinician stays with them during hospice. So a hospice team, you can have up to 5 members in your home, and then having the clinician there too, so that 6 people involved in your care, and then all the support staff of house call providers, the social workers, the care coordinators, the administrators. We're all so bound together in that mission that it's really a wonderful
It's a committed
place
group.
to
Well,
work.
speaking of that, and your employees and staff, I understand you're one of the top places to work.
Yes.
You were voted by the Oregonian, I think.
Yes, it was the employees that voted from their comments, and we got Best Small Workplace.
Great. Well, we're out of time, and I wish I could talk. I could talk a lot longer.
Right.
There's a lot more to ask, but thank you both so much.
Thank you so
Barb
much
and Todd.
Thanks for having us. Really appreciate
it was a pleasure. Thanks so much for watching Community Hotline tonight. I hope you enjoyed that segment. I certainly did. And if you're interested in being a volunteer, interested in donating either financially or of your time, or just to get more information, do go to their website. I'm Monica Weitzel. We're here in Gresham at MetroEast Community Media. We'll see you next week on Community Hotline.
Mm.